Good evening. It's Saturday, July 25th. It's 9:23 p.m. World Ominous has reset it. I've been extremely busy the past couple of days. Hardly even slept. Got so many projects to work on. I've been doing the same as before, getting all the news together, all that, the reports. So let's catch up. It's been 3 days, and the cases are spiking back upwards again. The deaths are trending back upward again, as more as before. Very alerting. Uh, Barometer has reset it. So for Sunday's numbers, we can already see Mexico as a very high number for it being a Sunday. And Kazakhstan isn't reporting its deaths on Warometers. It's hiding them behind their own country website, which is kind of sketchy. South Korea continues to get more numbers. China's still lying, even though they have 46. If you look at just, let me see what we got. South Korea, so Jamaica. For today's total, we had for a Saturday 258,000 new cases, pretty high for a weekend. That's the new normal now. USA number one still with 67,000 new cases. India second, 48,000. Brazil third, 48,000. South Africa fourth, 12,000. In terms of deaths, Brazil 1,111 deaths. USA 908 deaths. I thought that was higher. Because USA's been trending at 1,000 deaths per day lately. It's going back up. Kind of unusual that happened. Mexico 737 deaths. India fourth, 690 deaths. If we look at today's, let's see, state by state with the USA. Most cases, Florida 12,000, California second 10,000, Texas third 7,000, Georgia fourth 3,000. In terms of deaths, Arizona 144 new deaths today, Texas 137 new deaths today, Florida 125 new deaths today, California 90 new deaths today. Go to the bottom. Prisons, more cases. Veterans, more cases. Military did not report today, it seems. Now let's look. Do I have an option to? No, I don't. If we go back to the world cases, let's catch up with yesterday. Should have an option to go to yesterday. I would like the archives to go back further, but when it comes to the overall tally, you can only go back with 2 days. Yeah, 2 days. So 2 days ago, I didn't talk about this. It was a Friday. According to the way this thing works, USA was 77,000 new cases. Brazil 58,000. India 48,000. South Africa 13,000. Deaths. Brazil number one, 1,178. USA 1,141 deaths. India 761 deaths. Mexico 718 deaths. Now we have an out of control amount of excess deaths happening everywhere. Just what seems like hundreds of thousands of deaths expected more than last year, and they're suspected to be SARS-19. SARS-2 deaths, or not just that, but just people that died as a result of the pandemic out of starvation, wasn't able to get medical help because the hospitals are overwhelmed. We have a lot of people dying directly and indirectly from this virus, and we're never going to know the numbers because they're so inaccurate. We have data blackouts. Countries are just not reporting. Countries are blaming electrical problems, technical difficulties that they can't report. The backlogs are piling up all over the world. Numbers are coming in late. This is outdated severely according to how far backed up the numbers are. It's just horrifically inaccurate. This is not. Don't hold these numbers like a Bible. These numbers are highly inaccurate. The real numbers. Who knows how bad it's gotten to at this point, but it's really bad. And I have been doing the same thing as always, compiling the news every single day. Let's look at the top news from the past couple of days, and it's just a lot going on. So former Republican Beto O'Rourke of the Democrat of Texas accused GOP of participating in a in a death cult for their disastrous handling of SARS-2 pandemic. Why is space spent? Oh. Iowa. Authorities said Wednesday that Polk County buildings are now closed to the public until further notice to slow the spread of SARS-2. Pennsylvania. A rally was held in Harrisburg Wednesday to pressure Governor Tom Wolf to lift SARS-2 restrictions. The Assemble for Freedom rally took place in the steps of the state building. Speakers include local lawmakers and business owners. Some people also argue the restrictions are infringing on their freedoms. So we got some pandemic soldiers over here. Now, when it comes to businessmen being involved in here, a lot of them, it's not that they don't believe in the virus. It's not that they don't support the effectiveness of lockdowns. It's that their business are suffering, and they'd rather just take the risk of opening up than close down. And that explains some of the business owners. The Tokyo Olympics might not be held next summer unless there is a vaccine or other medical advancement regarding the SARS-2, a Japanese official said Wednesday. Whether the Olympics can be done or not is about whether humanity can beat the SARS-2, he said in Japanese. Specifically, to develop a vaccine or drug is the first point. Olympics are not going to happen. You're going to have to let that go for at least a couple of years if you want it to really be realistic. California's confirmed SARS-2 cases top 400,000, surpassing New York for most in the U.S. I talked about this at the beginning. California has 40 million people. New York has 9 million people. Let a virus go loose in New York. We saw what it did. Now let the virus go loose in California. Expect 4 times, potentially 4 times greater impact than what New York saw at their worst if this does not come under control. People need to realize the state populations. Not every state in America has the same populations. There are huge differences in state populations. Children are losing both their parents to SARS-2. Texas, young brothers Nathan and Isaiah Garcia lost their mother in early July to SARS-2. And just 15 days later, they lost their father who had been recovering from the virus. I didn't get to say goodbye to my mom and my dad, and that's what hurt me the most right now, Isaiah Garcia told KTRK. Dying now is more tragic than it was before because you die alone. You die alone without your family members, said Marcus Mendoza. We hadn't even begun to grieve my daughter. That's the grandparent speaking now. And now we have to bury Carlos, and the grandchildren are left without a mom and a dad, said Marcus Mendoza. This disease is just horrible. Now, I apologize. I don't know why Pastebin is all stretched out. Been acting weird today. When I started, I said both of my Pastebins didn't exist. So I was kind of confused what was going on. Either way, I have it all backed up. I don't care if it gets nuked. More. SARS-2 could lead to massive evictions, homelessness. As many as 44,000 renters in Santa Clara County could face evictions if federal unemployment supplements aren't extended past July. We are really close to that. Yeah, we're going to see a huge explosion of homelessness pretty soon if the government does not do anything to help all these people who have lost their jobs, who have been furloughed and have had their benefits cut out. It's a question of morality and ethics, and the government has failed horrifically. The time is now to prevent this eviction time bomb from happening, said Aziz. Federal supplements to unemployment insurance are scheduled to end this month unless extended by Congress. And they're still fighting over the stimulus check. It's obvious that there are people desperate for this money. Desperate. And these rich people are arguing whether the poor people should get more money. New York government Andrew Cuomo urged Trump on Wednesday to sign a national face mask mandate to help contain the fast-spreading SARS-2. If the president signs a nationwide mask mandate, you're going to see a revolt from the people that don't believe in it. It's going to be it's going to make the USA more of a laughingstock than it already is. But it should be done. People don't listen. SARS-2. Jury trials will remain postponed another 30 days. Yeah, I got a letter for this too, and I pushed it to way later. It's not the time right now. Chief Justice Beasley this week extended a number of directives in the state court system, hoping to limit the spread of SARS-2. The move covers all state courthouses throughout the 100 counties in the state. Yeah, so it's just incredible. This virus is just affecting everything, affecting everybody, affecting everything. It's incredible. Switching SARS-2 numbers from CDC to Washington has U.S. hospitals scrambling to adjust. Some states see data blackout as a result. So we already knew where this was gonna go. Yeah, we already knew where this was gonna go, and we're already seeing the effect. America calls for more SARS-2 testing as states see significant community spread. California, Florida, Georgia, Louisiana, and Colorado have turned people away or even shuttered overwhelmed testing sites. The problem: nasal swabs and reagents shortages. The chemicals needed to perform tests. This means the long waits for results, hobbling efforts to trace contacts and isolate infected. Results literally worthless if not reported within 10 days. This is happening a lot. If contact tracers got to wait 10 days to contact trace, that's, you've already defeated the purpose. It's already spread. You're just collecting the aftermath afterwards. Milwaukee and Madison reported hours-long wait. In Iron River, 142 test samples at a National Guard site were thrown away after being damaged while sitting in a hot vehicle. Yeah, the testing is just horrible everywhere in the world. And it's just, I think it's deliberate because they just don't want to suffer. The leaders of the world don't want to suffer economic damage. So they're just downplaying it, postponing it, pushing it back as far as they can, and it's going to blow up in all the poor people's face like it is already. Indiana, the number of people with SARS-2 being treated in ICUs has grown to about 50% more than earlier this month. Holcomb has declined issuing a state mask order. He also supports plans for allowing fans to attend the rescheduled Indianapolis 500 at the Indianapolis Motor Speedway. Additional, Ohio government DeWine issued statewide mask order. In announcing the advisory, DeWine talked about a group of 45 students from Belmont County who went to Myrtle Beach together. 28 people from that group later tested positive for SARS-2. I mean, people just don't learn until it happens to them. It's the way people are. Some people just are destined to learn the hard way. It doesn't matter what you tell them. School-age children could be more likely to spread SARS-2 to household contacts than any other age group. We got too many people who don't think this does anything to children, but many have died. Many have suffered brain damage, and it's just, the scariest thing about it is that it's still unknown what exactly is going on, but it is killing kids. And we see in South Africa how they left the schools open, and now the schools got outbreaks everywhere. 19% of people who shared a home with an infected person who was 10 to 19 years old contracted SARS-2, study found. The results suggest that reopening schools could lead to even more widespread transmission. That's actually one of the things that's saved us the most, is having the schools closed, but the governments are rushing to open them back up, and the teachers say it's an economic thing. Like I said many, many times before, that for the sake of the economy, they're going to sacrifice a lot of people by opening up too early and too carelessly. A New York City hospital created recharge rooms to give doctors, nurses, and other staff a place to recover from the stress of the pandemic. Now notice that the TikTok thing is gone. The whole nurse TikTok thing didn't stand right with me because TikTok is owned by China, and they use it to push propaganda and biased ways and control narratives. And when I saw the nurses TikToking, it just didn't seem right to me. It got to the point where they were getting in trouble for parading around fake SARS-2 corpses as a joke. But I don't know. I just felt like the nurses should have been showing what's going on in the hospital than dancing around making fools of themselves. But again, China is, it's a China-owned app, so I'm pretty sure China might. I have a feeling China might have had something to do with the whole TikTok nurse thing, to kind of silence the nurses, to keep them from showing the reality, to showing just really bad dancing. The New York City hospital, Michigan, several popular Muskegon area restaurants closed their doors as a safety precaution after employees are diagnosed with SARS-2. I think at this point in every state, in almost every city, our restaurants seem to be just shutting down every single day from outbreaks. It's just not helping to have a restaurant open. It's just not helping at all. And it's really tragic because a lot of these small businesses need the money, but they gotta shut down. Get ready for another SARS-2 lockdown in the U.S. Everybody says it could happen as early as August or to September 2020. Moreover, these lockdowns will almost surely be tighter and longer than the first wave of lockdowns across the country. Yeah, we're heading towards that direction. We're heading towards a giant, long wave of deaths that started a couple of weeks ago, according to worldometers, because they're not completely accurate. So I do see us going back into a shutdown, an even harsher shutdown. So we'll see what happens with that. Kentucky, SARS-2 outbreak at federal prison in Clay County. So we have prison outbreaks everywhere now. Right now is a really bad time to be a prisoner. A really, really bad time. California reopens outdoor hair, nail salons amid pandemic. I mean, really, it should have been more of a focus on wearing masks than trying to push things like this. U.S. Dozens of passengers have been banned from flying on Delta Airlines for not complying with the airline's mandatory mask policy. Oh well, really it's their own fault. Half of Baja California's SARS-2 patients in hospitals are dying. I think a lot of them are coming in from Mexico, but that's just alarming that there are hospitals that have such a high death rate and it's not being reported or talked about much. Summary, 6 months on, SARS-2 remains a mystery. There are still a lot of questions, a lot of confusion, a lot of scratching heads, a lot of PhDs, doctors, scientists that they don't know yet really what it is that we're dealing with. 723 News. Pennsylvania, infant who tested positive for SARS-2 dies. Berks County coroner says. The baby was admitted to Reading Hospital on the 19th and died a short time later at 8:40 a.m. The autopsy was inconclusive and a ruling on the cause of death is awaiting toxicology testing and further investigation. South Carolina, 2 more children with SARS-2 related inflammatory syndrome. Both are children under age 10 or under from the upstate region. So again, kids are dying, babies are dying, doesn't matter what age you are. We just don't know why this is happening. New Jersey, a SARS-2 cluster in Monmouth County in which about 20 young adults were infected with SARS-2 has been linked to a party in Middletown. Authorities said those infected are between the ages of 15 and 19. Now, this is what they get. I mean, you get what you deserve. But the worst part isn't this. The worst part is that these young kids can catch the virus. They can bring it home and kill off the parents with it, kill off the grandparents with it, and just cause community spread all over the city. If you just don't listen. And then, not just that, they don't even know. I bet you these kids don't even know how the virus works. They're just taking a chance out of ignorance. A U.S. Marine assigned to Marine Helicopter Squadron 1, the unit responsible for transporting Trump, has tested positive for SARS-2. U.S. hits 4 million reported SARS-2 cases as infections double in just 6 weeks. Now, this is only as fast as testing can go. And considering that testing is really bad, we should be way beyond 4 million right now. Hawaii officials today announced a new SARS-2 related deaths, along with the highest single day county of new cases, 55, since the beginning of the pandemic. The previous record was 42 on July 11th. More, Seattle. Washington's governor is tightening restrictions throughout the state in restaurants and bars, for weddings and funerals, and at gyms in a further effort to stem a surge in SARS-2 infections. Washington was one of the earliest states to report, and they've been very quiet. Now they're falling apart. Johannesburg, South Africa president says all public schools will take a break for the next 4 weeks as the country braces for its highest surge yet of SARS-2 infections. Yeah, like I was saying earlier, they left the schools open, and now they're about to see a humongous pile of dead people because they decided to not take precaution and close the schools. And I think they have a massive rate of excess deaths. I think 17,000 more deaths so far than expected this year. So, a bunch of those, unfortunately, are going to be indirectly caused by SARS-2. New Mexico authorities are investigating a deadly shooting at an auto shop after a man who refused to wear a mask tried to run over the shop owner's son and crash into a vehicle before driving off. Deputies found 2 men on the ground. One didn't have a pulse. So is he dead? That's a very vague way of reporting that. Uganda has confirmed its first SARS-2 deaths. The health ministry says a 34-year-old woman who died Tuesday was a support worker at a health center. It says she had been treated for the severe pneumonia in July. There's no way. There's no way that's the first death. They're just not capable of really tallying up all these results. Spain, health authorities have confirmed 971 new SARS-2 infections in the past 24 hours, the biggest daily increase since the outbreak has gotten under control. In 2 weeks, we have tripled the rate of the contagion. It's chaotic. New York street partying fuels fears of SARS-2 resurgence. Cases of SARS-2 among the young are on the rise as outdoor drinkings draw crowds in neighborhoods across the city. Now, I am tired of people, especially a very specific doctor, of these people saying that New York is now New Zealand, that New York has beaten the virus, that it's over. No, it's not over. They keep comparing New York to how it was at its peak. You don't do that. You compare New York to where it has been after the peak. And New York is climbing back up. And people think that it's all over, that it's over and done with, and they're going back outside and they're getting infected. So New York can possibly go back to where it was if they don't do anything about it. Additional, how SARS-2 killed a healthy woman with no normal symptoms. One morning, just after Easter, Rickson woke up with a numb arm. She never had a cough or fever, never lost her sense of taste or smell, and it would take doctors days to even diagnose SARS-2 and much longer to figure out how to stop her body's reaction to it. The insidious disease quietly caused her body to attack itself, inflaming her brain, paralyzing half her body, rendering her unable to see or speak, and almost killing her in the process. Researchers in Britain now believe SARS-2 may hit many more people with similar neurological symptoms than commonly thought, including younger patients. The fear is not only that these symptoms can be dangerous in themselves, but that they can linger and nobody knows yet for how long. This is not influenza. We documentedly have not seen the range of terrible complications we get with this virus. Again, this virus somehow attacks the brain. And this is not new. This is old news. It's just at the mainstream. It took a while to go mainstream. And during that time, all the people that knew this were being called crazy. But now it's all coming out, and it's all out. It's all out in the open now. An analysis of routine blood screenings conducted across the state. I think this is Louisiana. Yeah. So an analysis of routine blood screenings conducted across the state from April 1 through 8 suggests that Louisiana's true case count was 16 to 24 times higher than the 17,000 cases reported to the federal government as of April 8 and based on positive SARS-2 tests. This study is in line with other studies that show there is quite a lot of asymptomatic illness out there, said lead study author Dr. Havers. There are clearly a lot of people who sick who don't know they are infected. The study was based on antibody tests. This number would have shocked me back then, said Dr. Cantor. It doesn't shock me now. We learned a lot over April and the beginning of May about the significance of asymptomatic infection. I suspect there are 9 to 10 asymptomatics or mild cases for every case we find, said Hasig. If we get everybody to wear a mask whenever they were outside in their home in 4 to 8 weeks, we would see dramatic change. All right. Next, SARS-2 relief bill expected to include 1,200 cash payments. Yeah, I am really curious to see how they're gonna do this check because it just seems like they're up to something right now. Trump abandons plan for Republican convention events in Jacksonville, Florida, due to SARS-2 surge. Loser. SARS-2 could be second leading cause of deaths in Los Angeles. It's ridiculous. California, some counties set fines for virus violations. In the San Francisco Bay Area, officials in Marin and Napa counties have approved fines ranging from $25 to $500 for individuals violating public health orders, including failing to wear masks. Nearly 75% of detainees in a U.S. Immigration and Customs Enforcement custody in a Virginia facility have contracted SARS-2, raising alarm among immigration lawyers and advocates who repeatedly warn of deteriorating conditions. This case in Virginia has been getting pushed a lot. Just how it's a lot of lying, a lot of cover-up, a lot of data manipulation. It's a horrible situation. New Jersey, an employee at ShopRite in Marmora tested positive for SARS-2. The store announced Wednesday. The grocery store has kept him and her or her away from the workplace and has notified colleagues who may have been in close contact with the associate. Yeah, a lot of grocery stores are getting hit. That's why I bought all the food that I needed way back in February. Michigan. A dozen Felician sisters at a convent in Michigan died from SARS-2 in a single month, and a 13th sister died 6 weeks later, according to their order. Yeah, a lot of people are too blinded by religion to really think smart when it comes to the pandemic, and no, the blood of Jesus is not going to protect you. We're talking about more than 500,000 people missing from the U.S. population. The pandemic is disrupting births, deaths, and immigration rates, and the U.S. population could reach its lowest growth rate in 100 years. There's something nobody's really talking about. And 724 News yesterday. The White House is conducting contact tracing after a cafeteria worker tested positive for SARS-2, 3 Trump administration officials tell NBC News. The virus is just getting closer and closer to the White House. SARS-2 patients will be sent home to die if deemed too sick, Texas County says. The county has been forced to form what is being compared to a so-called death panel to allocate scarce medical resources on patients with the best chance to survive. A committee will deem which SARS-2 patients are likely to die and send them home with family, Jose Vargas, the county health authority, said during a news conference Tuesday. The situation is desperate. We cannot continue functioning in the Starr County Memorial Hospital, nor in our county in the way that things are going. The numbers are staggering. For all of those patients that most certainly do not have any hope of improving, they are going to be better taken care of within their own family and the love of their own home, rather than thousands of miles away dying alone in a hospital room, he said. Unfortunately, Starr County Memorial Hospital has limited resources, and our doctors are going to have to decide who receives treatment and who is sent home to die by their loved ones, Vera said in a Wednesday news release. This is what we did not want our community to experience. Yeah, how awful to send these people home so they can infect their families. How thoughtful. More than 200 babies under 1 year old have tested positive for SARS-2 in San Antonio, Bexar County. As of July 17th, there were 3,067 positive cases in children under the age of 18. Here's a breakdown of the cases in age groups. There are 211 positive cases in children under 1 year of age. There are 686 cases in children 6 to 10 years old. Just over 50% of the pediatric cases are in the 11 to 17-year-old range. More, the CDC, SARS infections are taking a lasting toll on people, even among those who had cases that were not severe enough to seek hospital care. Many people with milder SARS-2 symptoms continue to report health issues 2 to 3 weeks after testing. The study found that 35% of people who had SARS-2 and were able to self-treat were not at their usual level of health 2 to 3 weeks after testing. For people ages 18 to 34 with no underlying health issues, 1 in 5 were still feeling ill weeks later. Yeah, so this virus can potentially cause permanent organ damage. And I can't really say permanent yet because we have to follow up with these patients. But these people who supposedly recovered, who are more like survivors or can probably still be considered patients, a lot of these asymptomatics or people that are leaving the hospital supposedly fine have organ damage, and it stays with them. It doesn't go away, and many times they get sick again and again and again, or they die the second time they get infected. The Supreme Court on Friday denied an appeal by a Nevada church to allow additional worshipers to join in-person services based on capacity amid the pandemic. Well, good. Right now is not a time to be religious. Back during the Black Plague, people swarmed the churches, and they all died in the churches. So let's not repeat that. California, Shasta County's health department is asking hundreds of people who attended Wednesday evening's Christian music and faith event in Redding to self-quarantine for 14 days, get tested and monitored for possible symptoms. Again, these people just don't know how to listen with this religion. California, first LAPD sworn officer dies from SARS-2 complications, marking agency's second death from virus. New Jersey, officials on Long Beach Island say more than 20 lifeguards have tested positive for SARS-2 after being together at a recent event. Texas, a 5-year-old Dallas boy was among the 9 latest Dallas County residents to die from SARS-2. He is the county's youngest victim of the pandemic. Washington has just sent out a warning to watch out for an increase in bats with rabies in Seattle King County after a woman touched one with it a few days ago. Now, what's going to happen when these bats catch SARS-2 and then they have rabies themselves? Can that recombine? I don't know. I have to look into that more. Lastly, California nursing home inspectors are not routinely tested for SARS-2. Newsom says they will be now. In California, nearly 40% of all the people who have died from SARS-2 either worked or lived in nursing homes. That's a crime to not test nursing home inspectors. It's a crime. The people who didn't do that should be in jail for the deaths they have caused. They really should be. California. Oh, I heard somebody. California. New data shows that in Kern County, recent SARS-2 cases are spreading mostly among family and friends, often in private settings. Yeah, I think the majority, what it seems that's happening is that the majority of these new cases are from family gatherings, friends getting together, people partying, people going to Vegas and making road trips and getting together at different people's houses, and a lot of them they're so careless, and then once they catch it, they say, "Oh, what have I done? Please feel bad for me." And it's like, no, like you didn't listen. You didn't listen. It didn't have to be this way, but unfortunately, now you get what you deserve. U.S. records over 1,000 SARS-2 deaths for 4th straight day. So it's kind of weird that when we saw barometers right now, earlier at the beginning of the video, they were under 1,000. There's some data, some sketchy things going on. Like, again, the way governments are counting all this information is very sketchy. You can see barometers and then check the data the next day from the days before, and you'll see different numbers. There's something going on there. Arizona, Fry's grocery stores confirms one of its Yuma workers has died from SARS-2. So far, at least 10 local employees from 2 local stores have tested positive. Study finds homemade masks need multiple layers to prevent spread of SARS-2. Again, there's a lot of people that don't want to look this up. They don't want to research it. They just figure, okay, all I know is I have to wear a mask. Like, no, you need to know all you can know about this virus if you want to survive. These cloth masks that are being made don't work. They don't work. They don't have the same filters or fibers or that the kind of masks that doctors use have. And like the study says, you have to have multiple layers for it to do something. So get informed. Get informed. Don't think that, you don't need to know anything besides just wear some random masks that you probably bought at a liquor store. No, you need to get informed. Too many people that think that we're getting infected and are dying. People in my own family are like this. It's just frustrating that they don't want to listen. Hawaii hit another record number of daily SARS-2 cases today with 60 new infections, mostly on Oahu. Texas childcare facilities thrown into chaos amid SARS-2 crisis. In Texas, 752 children and 1,577 staff members at more than 1,400 childcare facilities have tested positive for SARS-2 so far. Spain is facing a second wave of SARS-2 outbreaks. So that's where we are. It's still getting worse and worse and worse. It, like Peak Prosperity says, it didn't have to be this way. If people would just had listened, put on the masks, social distance, we would not be like this. And now these same people are getting fed up and frustrated and they're going outside and then just making it worse. I have more, but I don't want to put too much on the table. It's already been a half-hour video. I have to do today's gathering of news. I'll do that in a couple of hours. I gotta do some other things. I'll pile it up, and then tomorrow I'll pile up the news for tomorrow. I'll pile up both of those reports, and I got some other reports to talk about too. I have a lot of info to go through. I just want to dump it all at once right now because it's already kind of lengthy. So tomorrow should be another day with a lot of talking, a lot of things to talk about. And thank you for watching. And I will see you the next time.